Good morning. I'm Kim McClary, President and CEO of the Los Angeles World Affairs Council and Town Hall. Thank you all for joining us. We hope you and yours are staying safe through these very challenging times. I am pleased to welcome you to a panel discussion today with several leading healthcare experts. George Green, President and CEO of the Southern California Hospital Association, Dr. Elaine Batchelor, CEO of the Martin Luther King Jr. Community Hospital, and Luis Ramirez, Regional Donor Services Manager for the American Red Cross. The program will be moderated by Dr. Tanya Altman, founder of Calabasas Pediatrics. I welcome all of our distinguished guests for sharing their insights and expertise today. Dr. Altman, thank you so much for guiding this discussion. I now turn it over to you. Thank you.
Thank you, Kim, for the opportunity to lead today's webinar conversation. And thank you to all of you for staying home and social distancing. I know it's not easy. Many of you have closed your businesses or made drastic changes for the good of the community. I myself played a role in the decision to close many of the schools in Southern California a few weeks ago, and it was one of the hardest decisions I ever had to make. But it was for the good of the greater public health to not only prevent illness, but also to prevent overwhelming our healthcare systems. And these measures have really made a difference. California is actually in a fairly good place, especially compared to other parts of the country and the world. But that doesn't mean we are in the clear. In fact, we are far from that. Even though we are slowing or flattening the curve, depending on which data source you like to look at, we still have a surge of COVID cases coming our way in the next few weeks. And that's what we are all here to discuss today and make sure that we are prepared in case the worst is yet to come. We are all being bombarded with information and stats on COVID-19, and it's often hard to decipher what's accurate and what's not, which is why I look forward to hearing from our panelists today to discuss topics on everyone's mind. Are we ready? Do we have enough hospital beds and ventilators? Do we have enough PPE, gowns, masks, and gloves? And it's not only the equipment. I trained at UCLA, and I can tell you that ventilators don't run themselves. Do we have enough doctors, nurses, and other healthcare providers and staff to use the equipment and care for our community of patients with COVID-19, those we currently have and those we are expecting to have in the near future? A few days ago, California Governor Newsom said California is making progress in securing additional beds to treat COVID-19 patients and relieve pressure on the healthcare delivery system. He announced that California had already secured up to approximately 4,600 additional beds at alternate care sites and shuttered hospitals to care for the anticipated surge of COVID patients, with even more capacity being finalized. The state has aggressively planned for the surge in hospitalizations in the coming weeks and aims to add 50,000 beds to our existing hospital capacity of nearly 75,000 beds. Today, we are fortunate to hear from George Green, President and CEO of the Hospital Association of Southern California. Mr. Green, there are 181 hospitals in the 6 counties in your association. Can you please talk to us about how are your hospitals doing today with their bed capacity, the availability of supplies and equipment and staffing resources? Do you have enough doctors and staff? And what's going to happen if any of them get sick?
Well, number one, thanks for the opportunity to be here today. And if we do have any who are participating in this town hall who are on the front lines or working for hospitals, or even in the field providing healthcare, I'd like to say thank you to all of you. You're true heroes because you're putting it all on the line on a daily basis to make sure that we can really try and flatten this curve and move us beyond this pandemic. So again, thank you to those of you who are in real time engaged in trying to get us through everything that our hospitals and our healthcare and our patients are facing right now related to COVID-19. When you talk about those issues, you talk about our hospitals prepared, you talk about surge capacity, you talk about supplies, you talk about staffing. I think the governor said it best. He called the solution a three-legged stool. It's about places, it's about people, it's about supplies. With regard to capacity, you said it absolutely correctly. The governor has asked us to be able to surge, us being hospitals, has asked us to be able to surge to 40 to 50% of the capacity that we anticipate being in our hospitals at the peak of this surge. Hospitals are going through an extensive process to be able to do just that. It's not going to be a one size fits all. I would say that there are some hospitals who are going to be able to get to that 50%. There are others who might not be able to get to that 50%. The good news is that we are in constant communication with those hospitals, not only here in the Los Angeles area, but up and down the state, so that if one hospital has hit capacity and cannot take more patients, then we're looking at ways to be in communication in real time with other facilities that might have the opportunity to take those patients that that one hospital might not be able to admit. You mentioned alternative care sites. We're also looking at alternative care sites. Some of those are being stood up by the state, some are being stood up by the county, some are public-private partnerships. And that is occurring all up and down the state as well to anticipate the surge. With regard to supplies, let's just call it what it is. Supplies are scarce. And whether it's masks, whether it's swabs, whether it's the testing kits, we are actively working in collaboration with counties, cities, the state government, the federal government, to try and obtain the supplies that we need. There was some good news this week related to masks. The governor stated that we've entered a contract that is ultimately going to bring 200 million masks to the state a month. And once those are online, we think we're going to be able to take care of the needs of all hospitals up and down the state. But this is an active process. So whether it's here in Los Angeles, whether it's in San Francisco, whether it's in San Diego, we are putting together collaboratives to identify supplies, identify vendors, set up vetting processes. I'm sure some of you have heard about the scams that are out there. So that when we identify supplies, these are the sorts of supplies that are valid and that are going to be able to be used in our facilities. That's a little bit of where we're at right now.
I mean, I think that sounds great, especially all the masks. I mean, as a healthcare provider here, I am reusing masks because I am aware that we are in short supply and I want to make what I have in my office last as long as possible. The governor also announced that California is going to be sending equipment out of state to help other states that are in need. Are you concerned that might impact our ability to care for patients here and the timeline of that?
I've got a lot of faith in the governor, and part of the reason I have faith in the governor is because when he came into office, he described himself as the healthcare governor, and he has been engaged with healthcare providers and on healthcare issues from the time that he came into the office. I would say that as soon as we identified that this was going to be a pandemic, we are in a very lucky position when it comes to hospitals, because HASC, so the Hospital Association of Southern California, of which I'm the CEO, has a partnership with the California Hospital Association, and CHA actually is embedded with the governor and his team. And so on a real time, we are sharing with the governor and his team what the supply needs of our members are. I know that some have heard about the fact that we are shipping ventilators to other states. The governor has stated that we actually have 11,000 ventilators in our state. And we are going through a process of trying to identify places where they need ventilators so that if there are excess ventilators, they can be shifted to those facilities. The counties and cities are playing a big role in this for us here in Los Angeles. And I do believe that when you look at some of the models as to when the peak will occur, the governor has made a commitment that when we need those ventilators, and there have been, I believe, approximately 500 ventilators that have been sent out of state, that we will recoup those ventilators if we hit surge and need them. So I do believe that there is a very concerted effort to do planning. Some people have said we're kind of building this plane as it's flying. And in some ways it's true. Again, I'll go back to an earlier statement. The good news is that we have open lines of communication. We have people that have one thing as our focus: getting through this pandemic, making sure that our hospitals can keep their doors open, and keeping patients safe. So when it comes to supplies, as I mentioned earlier, we know that we need more, but there is active planning going on right now to make sure that when we need those supplies, when this surge hits, we're in the best position possible. Will it be a silver bullet? No. But it would be a much different story from my perspective if we didn't have people collaborating, putting politics aside, putting competition aside, and putting patients first.
Yeah, and I agree with you there, everything you said, putting politics aside. And I think Governor Newsom actually, has made really strong decisions for our state, and he acted quickly and early, which is why we are not the same as New York. And so I'm very thankful to that. He also recently announced the California Health Corps initiative to recruit and expand the state's healthcare workforce. So I'm wondering, which I think is great to help get doctors who might be retired, maybe not practicing now, and other healthcare providers. Do you have any idea like how and when that will be implemented or rolled out?
So it's my understanding that they're in the process of rolling this out. And I do believe that there are over 80,000 healthcare workers that have been identified where we might be able to utilize their services through this pandemic. So I think that that's going to provide great assistance to hospitals all across the state. I would say I need to give a shout out and some props to Mayor Garcetti here in Los Angeles, because he has worked with HASC to create a job portal to do much of the same for the Los Angeles area. And the traffic that we are seeing on that job portal is already beginning to demonstrate not only was it needed, but people and hospitals are utilizing that job portal. So it's been a great partnership with the mayor, between the mayor and HASC, to create that local job portal.
Yeah, and I've seen that portal posted on a lot of my medical listservs, and I agree with you. People are taking advantage of it, which is great. Thank you, George. Any last thoughts before we go to Dr. Batchelor? Although I assume there will be more questions, for you at the end.
Again, thanks for the opportunity. And I would just say that I know that this is an anxious and scary time, but please, to your audience, to the public in general, know that between local elected officials, state elected officials, federal elected officials, public health officers at the local level, all the way up to the federal level, and lastly, your hospitals, the people who run your hospitals, the people who are on the front lines providing care on a daily basis in your hospitals. This is tough work. It just got a lot tougher. But one of the things that I've always believed is that people who get into healthcare, if they don't know it's a tough business, a lot of people do. Once they start providing that care, they realize pretty quickly how tough this is. Things just got tougher. But we have a healthcare workforce in place. We have hospital leadership in place. And again, collaborating with decision makers and community stakeholders, we're doing everything we can, not only to get through this pandemic, but to try and keep patients safe and get them healthier through this pandemic. Patients are front and center for hospitals all across the state of California, and we will continue to step up to this. The system will be stretched, but I'm confident at the end of the day, hospitals are going to be able to meet this challenge on behalf of the patients all across the state of California. So thank you.
And thank you. I mean, I know that as a physician, that makes me feel so much better, because I know that's something that a lot of my patients and my community, are concerned about. But I also do feel like we are doing a very good job in Los Angeles and California. So thank you for that and your work. Our next guest is Dr. Elaine Batchelor, CEO at the Martin Luther King Jr. Community Hospital, which opened in 2015 and is affiliated with UCLA. Hi, Dr. Batchelor. Thank you. Welcome. I was wondering if you could talk a little bit about how your hospital is dealing with COVID-19, how your operations have changed since the outbreak, and what you've learned by looking at New York and other places in the United States and abroad in terms of planning and managing, your hospital.
Okay, well, thank you very much for inviting me to participate in the seminar. And it was good to hear from George. I think George did a great summary of the challenges that we're facing as hospitals, and also the preparation that we are involved in. And we're basically focused on doing about 6 things right now. First, we are procuring and managing supplies and equipment that we need to provide safe care for patients with coronavirus. Primarily, this means what you mentioned before, the endless search for PPE, which stands for personal protective equipment, These are the masks and gloves and face shields and isolation gowns, disinfectant wipes, hand sanitizer, all of those supplies that we need to provide safe care for our patients and protect our frontline healthcare workers. We are also planning for a surge in coronavirus patients that we think we may see in the next week or few weeks. And that means that we are adding inpatient bed capacity. So we're adding beds to our medical floors. We're also looking at how to add beds to the ICUs. And as George outlined, that means finding the space, finding the supplies and the equipment, and finding the staff, both the physician staffing and the non-physician clinical staff. The scarcest resources right now are the PPE and the staff to take care of the patients that would be in those beds. In our hospital, we are increasing bed capacity by doubling up rooms that are usually single rooms, by converting a post-op care unit into extra ICU space. We also have a new medical office building that has an ambulatory surgery center with a PACU that could also be converted for extra ICU space. We are ordering additional ventilators. We started out with about 12. I think we're up to about 17 now. We've also ordered BiPAP and CPAP machines, which are useful for patients who are being stepped down from a ventilator and will help us conserve the ventilators. We're also engaged in training and preparing our staff, making sure they stay informed about what is happening and they know how to safely use PPE. We call it donning and doffing, so they know how to put the masks on properly and the gowns, and they know all of the hygiene protocols for taking care of our coronavirus patients. We are also engaged in expanding and promoting virtual healthcare. And this is really important in our community because a lot of the residents in our community rely on the hospital emergency room for care. About 40% of the patients that we would normally see on our ED are what we would call low acuity patients. We would like those patients to stay home now so that they are not exposed to coronavirus and so that we are not consuming valuable hospital resources taking care of patients who could be cared for at home or in lower acuity settings. So almost overnight, we've expanded our telemedicine capabilities. We have engaged in an intense community health information campaign to educate people in our community about how to use telemedicine services and the services that are available to them. We've even contracted with a vendor to expand the service availability so that it's available on demand to anyone in the community who needs it and doesn't have it from any other source. The next thing that we're doing is we are raising funds to help us expand services, to help us bring in all of the extra resources that we need, and to offset the COVID-related expenses that we're taking on now. And then finally, we are staying in close contact with the state and local and federal public health agencies and governmental officials who are helping to manage the response so that we're up on all of the latest guidelines and requests that we're seeing from those agencies. George talked about the request for all hospitals in California to expand their beds by at least 40%. We have a plan to do that and even more if necessary. Those are sort of the basic things that we're doing to prepare. It's all guided at most hospitals by what we call an incident command center, which is a center that has all of the logistics and medical and communications resources that are needed to coordinate all of the activities involved. We've put up 3 additional tents in front of the hospital so that we can manage the patients that are coming into the ED and keep the respiratory symptom patients separate from the non-respiratory symptom patients. We wouldn't want someone to come to the hospital and be exposed and get it there. So we have some separate tents for psychiatric patients, for medical patients, and for patients who may have COVID-19. We're also standing up testing in our hospital labs. So we're repurposing lab space so that we can do testing on site in the lab. So those are some of the things that we're doing. We're seeing a gradual increase in the number of COVID-19 patients. And we're also seeing those patients, some of those patients start to deteriorate once they're admitted to the hospital and moving from medical floors into critical care areas. So we're trying to make sure that we balance the availability of those beds and match that with the needs of the patients.
Thank you. I love that you talked about how you're setting up tents outside to sort of segregate patients. How is the testing working at your hospital when these patients come in? If you think they have it, or even if you're not sure, how fast is the test coming back before you can sort of separate them into the COVID area or the non? And then also with your staff, how does testing work for them? And do you have healthcare providers that are strictly for COVID patients and one for non-COVID patients so they don't mix around?
Yes. So as George mentioned, the testing is still a limited resource. We are currently relying on a variety of different places for testing. We use a commercial lab, Quest. We also use the public health lab. We have an arrangement with another provider that's doing testing. And we also have all of the equipment in our lab to do the testing. But the item that's in short supply is the reagents. And the reagents are being allocated by public health agencies. And we haven't gotten an allocation of the reagents yet. We expect to have the reagents by the end of this week, at which point we'll be able to do 16 tests a day in-house. So we will still need to be using the commercial labs and the external testing areas. The timeline on getting the results back, it can be up to 48 hours. And there was a bit of a backlog in the labs, which was lengthening the turnaround time. And so we're still seeing a bit of a long turnaround time. So the results don't come back immediately. So we triage patients based on their presentation. So if they're presenting with symptoms and signs of coronavirus, we separate them from people who have other symptoms and signs. We do have a dedicated group of healthcare workers that are working in we call it our coronavirus tent in the ED. And we have designated one floor in the hospital for now, where we put all of the patients who are suspected, what we call PUIs, or persons under investigation, and those that have tested positive for coronavirus. So we're trying to cohort those patients on the same floor so we can limit exposure.
Thank you. I mean, I think that was very interesting. I'm glad you explained all that, because I feel like a lot of lay people don't really understand there's that lag in testing. So as a medical provider, we have to sort of make decisions and act based on our suspicions of whether or not the patient does have COVID-19 or not. And I think 48 hours from Quest is great, because when I send from my office, it still takes like 6 to 7 days. So I'm glad they're doing yours first, because I really think that that's where the priority should be in the patients that are, sick enough to need to be in the hospital. Anything else you want to share with us before we go to Luis Ramirez? And then I know everybody will have questions for you afterwards.
Yes, one thing I wanted to bring up is the racial and economic disparities that are starting to emerge across the country. We're starting to see that certain communities are being harder hit by this pandemic, that there's a higher prevalence, and when patients get sick, they're not doing as well. And that is very typical of the community that we serve at my hospital. It's a very underserved community. There are large deficits of healthcare resources. And I think the pandemic is really unmasking the deep underinvestment that we have in communities of color and the underlying reservoir of chronic illness that exists in those communities. These are the patients that are at highest risk, those with diabetes, kidney disease, hypertension, heart disease, pulmonary disease. Our patients have a lot of untreated and poorly treated chronic illnesses that are making them more vulnerable. And we're starting to see those folks come into the hospital and get worse and have the poor outcomes. So I think that this pandemic is an opportunity for us to all see where the dysfunction in our health care system really needs to be corrected, and how it impacts all of us, because the people that we're seeing and that are in our community are the same people that prepare food in restaurants, and they're the people who take care of children in daycare. They're the people who clean our homes. and service workers and a lot of different industries. We can't segregate ourselves from our people. So we need to make sure that our healthcare system is set up to take care of everyone and to take care of everyone well.
That is a really good and important point. Thank you, so much for bringing that up. I mean, I think, as unfortunate it is that we have to go through all this, I do hope there are important learning lessons so we can make the system and things better for future. And especially so if this does happen again in the future, which likely it will, hopefully far in the future, we will have a better way to, to care for people and to help, with the underlying medical issues that makes them more prone to serious illness when they are exposed to different pandemics and illnesses that go around. And again, once we do have a vaccine, I hope we have a way to get these people, to get everybody that needs it, the vaccine in, in a good way, hopefully next year, so that way there aren't disparities in who is getting vaccinated and who's not. I just want to let everybody know that after our third guest, we will be opened up for questions, so you can ask questions to any of the panelists, or even myself if you have any questions, and we do have plenty of time for that. So our third guest is Luis Ramirez. He's a regional donor services manager for the American Red Cross, and I know that all of you know the Red Cross. We all know and love the Red Cross. So Luis, the first question I'm going to ask you is just, how has this pandemic affected blood services?
So it's really interesting. 2 weeks ago, it was a completely different story. We had a number of blood drives cancel because people started working remotely. Populations weren't there for us to collect appropriately. And in the time being, we've had a phenomenal support from the community. And as a result, we've been able to stabilize our blood supply, and we've been able to be in a position where no patient is going without right now. So that is a huge testament to our community answering the call and being of service when we've needed it the most.
That's so great to hear. So for those of us listening today that might want to donate blood, and usually we'll go to like our local school, church, or company for those blood drives which have been canceled, how can we donate blood?
So we have a number of different vehicles to do so, right? We have a phone number. You can call Red Cross, 1-800 Red Cross, and get online and make an appointment that way. We also have our donor app, or if that's is more your speed. And then you can also sign up online as well by going to redcrossblood.org, and any of those will allow you to identify the blood drives that are close to your community and donate. The one thing that we are asking in an effort to provide social distancing and a safe environment at our blood drives is that everyone make an appointment. Currently, that is something that we're really driving home, is that people honor those appointments so that we can ensure that social distancing and give that adequate space.
That is great. Can you talk a little bit about, is the blood being screened for coronavirus? And then what about plasma donations? Is the Red Cross set up yet to take plasma donations from people who are recovered after they have the infection?
So we're working with the FDA with convalescent plasma, and if we have any clinicians that are interested in supporting that, they can go to redcrossblood.org as well. It's on our landing page, and individuals can get additional information from that, as well as if you're a donor that wants to participate in that. There's 2 forms, and you just click on what you're looking for, and you'll be able to provide your necessary information, as well as get any information or questions you might have. It's a very fluid situation. It's something that is brand new to us, so that mechanism is the best way to get the information that you need.
Great, thank you so much. I think this is the time that we're going to open it up to questions from anyone. I want to say in the audience, I guess the audience listening out there in our virtual, audience world of Los Angeles. And I think, Jessica, were you going to moderate the Q&A from the audience?
Yes, I will go ahead and take those questions. So Dr. Batchelor and George, if you can join us again, that would be great. Luis, since you're here, I'll just start off with a question for you. Is there any age limit for blood donations?
Yes, 16-year-olds and above. 16-year-olds with the parental consent, 17-year-olds without.
And what about on the other end for the people that are maybe
as long as they're healthy, we will have them come in.
Okay, great. Thank you. This might be either for Dr. Batchelor or George. What percentage of PPE requirements can California meet independent of federal government assistance? Are California companies producing these now?
That is a good question. I know that we are short of PPE currently, and I know that there are independent organizations that are looking to fulfill those needs. But at this time, I couldn't give you a hard percentage as to what we will be able to meet with regard to those requirements. I can tell you that every effort is being made to be able to either get our hands on or work with organizations that are producing the amount of supplies that our hospitals are going to need. And I hope I didn't interrupt you, Elaine.
I can tell you that we are sourcing PPE from around the world. So there's a shortage. I don't think that California is yet able to meet our needs, perhaps in the future, but right now we are sourcing it from wherever we can find it, and that's all over the world.
Thank you. Dr. Batchelor, this might also be for you. Someone thinks they may have already had dealt with COVID-19 and has recovered from it. Going forward, what are the implications for them, and what are the implications for others that may come in contact with them?
Well, I think that we all know that if you come in contact with someone who has COVID-19, you're being asked to quarantine, to isolate yourself from other people for 14 days so that we can make sure that you don't have it and that you're not able to pass it along to others. The incubation period for the virus is up to 14 days, so that's why the 14-day period. People who are recovering, really it runs the gamut. Some people have very minor illness while others are ending up on respirators with severe lung disease, and some people are being left with chronic lung incapacity. So it really depends on the severity of the illness that you have.
Thank you. George and Dr. Batchelor, this would also probably be for you. How are healthcare personnel at all levels protecting themselves from acquiring COVID-19 from patients and each other, both at the healthcare facility and when they travel outside the facility?
That's a great question. So the primary means of protection for healthcare workers are hand hygiene, which we emphasize a lot and is being emphasized for the general public, so really washing your hands a lot. And this personal protective equipment that we talk about so much. It's critically important for frontline staff. These are the masks, the goggles, the isolation gowns, the gloves. All of that equipment is what healthcare workers put on when they care for COVID-19 patients. They need to be trained on how to use it properly, how to take it off without contaminating themselves, how to dispose of it properly. And then when they go home, what we're finding out is that many people who are working with COVID patients are concerned about infecting their family members. And so they're changing out of their work clothes either before they get home or at the front door when they get home, and then going inside, taking a shower, making sure they're clean, and then changing into other clothing so that they're not infecting other members of their family. So those are some of the basic protections that people are taking. Some workers are actually living separate from their family while they're working. And one of the things that we're doing for our staff is providing hotel rooms for those healthcare workers who don't want to go home or maybe have some situation at home that prevents them from going home.
Wow, that's incredible. This one would be for Luis. Many people want to provide blood, but they are concerned about how social distancing can be possible given the procedure involves putting a needle in your arm. What steps are the blood centers taking so that we can share with our communities about how safe it is to give blood?
So yes, social distancing is only one of the components that we're using. We're also trying to all of our staff that are performing any of the procedures are wearing masks themselves. There's some pre-screen that we do at the beginning of every day. They're supposed to take their temperature before they leave for work. When they get to work, they're screened again. and as well as our volunteers. We also have masks for our volunteers, as well as hand sanitizers. So anything that any of the things that the donors are touching are wiped off in between donations. So again, the social distancing is just one component of many components that we're trying to implement, or that we have implemented it to secure a safe environment for our donors.
All right, and any special advice for pregnant women in the third trimester who are expecting to deliver in LA County near the likely peak of the COVID-19 crisis? Will we need to do anything differently? And will everyone, nurses and other non-physician staff, be properly protected, equipped to protect mothers and babies?
That's a great question. And I think that one of the things that's been challenging about this infection is that it's pretty new, and we are still learning how the virus is transmitted. We're learning how people are affected by it and how to protect ourselves. I do think some of the changes that we're putting in place for the pregnant women is some of the staff will be wearing protective garments, so you'll see them wearing masks and isolation gowns. There's a limit on visitors to hospitals, so most hospitals are allowing women in labor to bring a companion or partner with them, but there's a limit on other visitors that are coming into the hospital. And we want to keep the OB patients separate from other patients in the hospital. We don't want to see a lot of cross traffic through that OB unit. So those are some of the changes that you might see.
Yeah. Can I add, I talked about this on the news actually this morning, and a lot of moms are saying, is it still safe to deliver in the hospital? And my answer is absolutely yes. It's one of the safest places to be, because the hospitals are doing an excellent job of really keeping labor and delivery locked down, sterile. They are limiting the number of support relatives that you can have with you, but there's rumors that you can't have anyone with you, and that is not true. There is one person allowed, whether it's a partner or a support person. When the babies are being born, they are still allowed to go right with mom to breastfeed, to be close. If mom has COVID-19, then that's a decision the doctors have to make, and they may, in some cases, separate the babies at that point, but we still want to encourage breastfeeding and pumping and feeding babies breast milk.
Thank you. George, this one is for you. Where can local California suppliers send their inventory of PPE and other medical supplies and equipment?
Thanks for the question. And I would also like to say thanks for that previous piece of information, because my wife is 7 months pregnant. So it's an active conversation in our house. So thank you for that. And I know she's listening. So hopefully we're reducing her anxiety levels a little bit. So we have someone on our team who is triaging all supply information. And if you could go on to the HASC.org website, that's HAS as in Sam, C.org website, and you can look up Susan Harrington. Susan is handling all things related to supplies for us. And so whether it's vendors or people who are seeking supplies, she will be able to triage that information and get you connected to the appropriate organization or individual.
Great, thank you. Dr. Tanya, this one is for you. How is the virus impacting young children? And maybe to add on to that, how should parents be communicating with their children about what's going on?
So that's a really important question. I mean, luckily, most children are having mild illness. Now, of course, as we see more and more numbers in the community, you're going to see every age group is going to be affected, and there will be people in the hospital at every age group. But in general, we're not exactly sure why. It has to do with how the virus infects the body, the ACE2 receptors, kids' immune system is different from adults. Luckily, kids don't seem to be getting quite as sick. Because kids are home from school now, all the kids know something different is going on. So you can't hide it from them. It is something that you do need to address and talk to your kids about, depending on the age level of your kids. So for young kids, it'll be talking about, you know, a new germ. I have a 5-year-old who back when he was in preschool a month ago, came home and said, "Mommy, there's a new flu. We have to wash our hands differently now," and he showed me. And my teenagers, they really do know what's going on, and they can have more facts about the virus. And so it's really spending time with your kids, creating a routine and a schedule at home so they feel safe and secure, answering their questions. So I always say, ask your kids what they know, correct misinformation, and then really, try to comfort their concerns and anxiety and fears. And as a parent, it's most important that you take a deep breath and are calm yourselves and get a hold of your own feelings and emotions first, because if you're freaked out about it, it's going to put that onto the kids and it's going to make them more anxious. When this is all over, what our kids are going to remember after all of this is how they felt and the time that they spent at home together with their families. So I'm really encouraging parents to make the most of this time. Play board games, cuddle with your kids, spend time with them instead of having everyone in opposite parts of the house on devices, because these are the memories that your kids are going to remember when this is all over.
Thank you so much. This would be for Dr. Batchelor or for George. Are there any issues in California regarding disposal of used masks and protective gear? Do you have any tips for all of us when it comes to disposing of gloves, masks, etc.?
I'm not aware of any issues. I think this is something that hospitals are used to dealing with normally. We have protocols and resources in place to dispose of medical waste and things that are contaminated, and we're using those protocols. So I'm not aware of any problems or challenges with that. And I think as long as you are, putting things in the trash and making sure that it's sealed and that it's not lying around the house where other people can touch it or it can contaminate other objects, then you're probably fine.
Great, thank you. This would also be for George and Dr. Batchelor. People are being innovative and entrepreneurial. Do you have any local examples of businesses or entrepreneurs answering the call to help?
You guys didn't ask me, but many local schools and their science departments are making face shields for healthcare providers. This one's from Viewpoint School. So I feel like kids in the community are getting very creative and wanting to help. They're all home now and they're wanting to help and do things, which is wonderful.
We've had an outpouring of donations and support from the community and from many different places in the community. We have about 100 community members who are currently sewing isolation gowns and making face masks. There are seamstresses who normally work in the entertainment industry who are not working right now, and they've all repurposed themselves to sewing these gowns and masks. We've had restaurants that support our frontline staff by bringing food in. Our staff are working hard, but they're really being well supported with snacks and food from the local community. We've had all sorts of people reaching out to us to try to help us source PPE with donations and with companies that have relationships with PPE suppliers. And we also are seeing a lot of companies that are involved in telemedicine reaching out and helping us stand up new telemedicine tools and resources. We've converted some of our emergency physicians to remote visits, and our hospitalists are able to do rounds with teams even if they aren't on site. We stood up something that we call a chat bot. It's an artificial intelligence powered piece of technology that allows people to ask questions and get answers in real time. So we're seeing a lot of innovation around how care is delivered and some of the tools and resources. We're also starting to look at how to provide more care at home with biometric monitoring devices. So as we have patients that are recovering who can move out of the acute care setting and make space for sicker patients, we want to make sure that we continue to monitor them at home. So I think this is some of the innovation that we're seeing right now, and it's really accelerating some of the trends that were already starting to emerge, but now is a time when we have a great need for them. And so we're seeing just a tremendous amount of adaptation and innovation among our staff and the vendors that we work with.
And I would share that is going on all across the state. I hearken back to my earlier comments about the fact that people are in healthcare because they have a heart for healthcare and they have a heart for taking care of people. The innovation that's going on that Elaine has mentioned has really, in some cases, just blown my mind. The fact that teams who are used to providing patient care are going to Michael's, going to Home Depot to get supplies so that they can repurpose masks. I would tell you that we actually have someone on our team at HASC. It really touched my heart the other day, sent the leadership team a picture of their 2 young boys who were creating cloth masks to pass out to the elderly. So, you know, there is a lot of innovation going on right now because people know that supplies are in high demand, and they're really getting creative in ways that will still protect our staff and protect our patients.
And a lot of volunteerism too. I was surprised one day when I came home and my son had on a button that said, I donated blood today. And my son's 17, and I said, you didn't ask for my permission before you did that. And he said, no, I don't need your permission because I'm 17. And I was really touched by the fact that he went to do that, and that he thinks he's adult enough not to ask me.
That's great.
Yeah, and thank you for that.
What is the criteria for your hospital to administer hydroxychloroquine to your COVID-19 prospective patients or those who definitely have COVID-19? Is this drug in good supply at your facility?
I am not an expert on the use of hydroxychloroquine for COVID-19. I will tell you that I'm a board certified rheumatologist though, so I am pretty familiar with hydroxychloroquine, and normally we use that drug to treat lupus and rheumatoid arthritis. I do think that there's an adequate supply at the moment, and our providers are, you know, really just sort of learning about the potential use of hydroxychloroquine and looking at the emerging evidence for it.
Great, thank you. George, there's been much focus on LA County. What's ahead for your hospitals in Orange County, Ventura County, and Riverside County?
They are engaged in much of the same activity as our hospitals in Los Angeles County. So at HASC, we play a leadership role in engaging and advocating at the local level. So think cities, county boards of supervisors, community-based stakeholders, and we represent hospitals in 6 counties in the greater Los Angeles area. We've got 184 hospitals that we're working with. And so once this pandemic was upon us, as it were, not the surge, but once the pandemic was upon us, we reached out to public health officers in each of the 6 counties. We reached out to the city councils, to the county boards of supervisors, and in all of the counties, there are weekly calls that are held between hospitals and the offices of local elected officials, public health officers, to discuss what are the county's actions, what are the city's actions, what are their needs, what are our hospitals experiencing in the field, what are their needs. So again, going back to that coordination, that communication, so that we can be supportive of each other. And it's not just about supplies, it's not just about staff. We have identified the fact that there are regulatory challenges to us being able to provide the sort of care that you need to provide during a pandemic. And so we have asked for flexibility with regard to some of those regulatory challenges from the local level all the way up to the federal level. And so we've created those sorts of ongoing venues in each of the counties to have that sort of conversation.
Great, thank you. Luis, this one is for you. Currently, a donor must wait at least 6 weeks before donating blood. Is any consideration being given to shortening that time so those of us who want to give more frequently can?
No, we take our recommendations from the FDA. People can donate every 56 days. However, when donors come in, we do have what we affectionately call a power red donation. They can come in and they can donate specifically only their red blood cells. And that is a concentrated donation. It doesn't take the plasma, it doesn't take platelets, it's just red blood cells. And that's essentially reserved for our donors that are O negative, O positive specifically, so that they can, that's what we usually need the most of when it comes to red blood cells. So it's not necessarily donating sooner, but you are making a bigger impact by making one of those donations.
Great, thank you. Dr. Batchelor, how has the role of data and data analytics helped you to deal with COVID-19?
That's a great question. So I would answer in two ways. One is that I do a lot of reading, and I am trying to stay abreast of all of the data and information that's being collected and disseminated. Just as an example, earlier today, I had a meeting with my staff to talk about how many beds we think we will need to add. And that's where looking at the trends and the data and the projections is very helpful and trying to help us plan to meet the needs that are coming ahead. The other resource that I have available is a department and a leader at my hospital who is an expert in geospatial data analysis. And so he takes all of the data that we see of the patients that are coming to the hospital and that we've gotten to know over the last 5 or 6 years that we've been open. And he actually maps the hot spots in our communities so that we know the areas that need the most resources and the issues that are prevalent in those areas. So looking at the data and identifying the trends is very important for that planning of resources and matching resources to need.
Great, thank you. And this will be our final question. This question is for Dr. Altman and Dr. Batchelor. What is the current thinking from the CDC and healthcare professionals about how long these shelter-in-place orders will stay in effect after the apex in COVID-19 cases occurs? $1 million question for both of you.
Yeah, I mean, it truly is. I mean, I don't have a crystal ball. I do feel like we are in a much better place in California than other places. And, you know, if you look at, Dr. Batchelor was just talking about data and stats. I was a math major, so I love data and stats. There's a lot of great websites that can show you the curve and where we are on it and sort of predict. As someone who's making decisions for the schools and the kids in our community, I feel like we do need to stay home longer. We are not there yet. We're not ready to start opening up businesses and communities and schools. What I am sort of anticipating is that we will all be home through May, and then in June, things will slowly be opening up, and schools and companies and camps that open up, they will have specific programs in place for if someone is sick, how to test them, how to isolate them, how to contact trace everyone who they've been around. And we're going to have these systems in place. It's also going to be a new normal. We're not going to be shaking hands anymore, you know, as business leaders, or, you know, in some of the private schools, the kids get out of the car and shake the teacher's hands. We're going to be staying a little bit more apart. We're implementing ways at school that the kids are going to be regularly washing their hands over and over again. We're debating on the use of face masks for kids that are in activities this summer. So things are going to be changing. It's hard to know for sure, but I really don't foresee things sort of getting back to normal until June at least. I don't know. What do you think, Dr. Batchelor?
I agree with you. I think that it's going to start to taper off towards the summer. I think that our ability to go back to more normal activities is partly going to depend on having testing more broadly available so that we can do containment when we see little outbreaks of coronavirus. The public health authorities are also saying that there will likely be a re-emergence of more widespread coronavirus in the fall. So I think we are going to be dealing with this for quite a while, at least until we have a vaccine. And I think having more testing available will make it easier for us to identify who's infected, trace their contacts, and move more towards a containment strategy. But I agree with you on the timeline.
Yeah, the other thing I want to add is that, you know, right now we're sort of assuming once you've had it, you're protected. We don't know that's the case. I mean, this may end up being like the flu where you can get it, you know, every season, or some people are partially protected and others are fully protected. And that's one of the issues with the antibody tests coming out. And I think one of the early questions was sort of asking about that. What, you know, if I think I had it a month ago, are there tests that I can do to know if I had it, and then am I protected? So there are antibody tests that are coming out very soon, probably by the end of this month. But that will just show that you've been exposed to it and you're making antibodies. It really doesn't tell us, are you protected? Are your kids okay to go to summer camp because they can't get it? We don't know that yet. And that's a lot that we still have to figure out, which is why, you know, it's so great that we have so many important and smart, much smarter than me, scientists and doctors, you know, really working on all of this, because this is still new and there's still so much that we have to learn.
Much. So if there's any final remarks you guys would like to say, otherwise we're going to turn it back over to Kim. I think that's it.
Thank you to our expert panelists for this very informative discussion. And thank you to our audience at home for joining us today. We would very much appreciate your input on today's program, as well as your ideas for future programming on the survey that immediately follows this program. And please join us tomorrow. We will be featuring a program on Italy, featuring Consul General Silvia Chiave, who will be moderated by Sewell Chan, who is the Deputy Managing Editor at the Los Angeles Times. So we'll get an update on how Italy is doing. Please visit our website at lawac.org to find out how you can support our programming and sign up for future programs. Stay safe, stay informed, and we hope to see you soon. Thank you so much.